Welcome to Radiologists, a podcast by University Medical Imaging Toronto, where we discuss the most interesting topics through the lens of Canada's largest medical imaging department. I'm your host, Satish Krishna. About 10 years ago, I was very excited for my very first trip to Las Vegas. While others might have traditionally been interested in the casino and the nightlife of Vegas, I was actually more interested to see the Grand Canyon. So the first day I reach Vegas, I take the bus trip to reach the Grand Canyon, and I'm whisked by a helicopter, and my first view of Grand Canyon is from above. And I still remember the second. I was completely breathtaken by the beauty and the vastness of the canyon. However, one thing which struck me was that why is the Colorado River meandering? I mean, it starts from the Rocky Mountains, it goes into the Gulf of California. Wouldn't a straight line make the most sense? Would it be the most efficient way to reach there? Why then is it meandering? Why then does it have all these twists and turns? And why then does it change course? Or am I missing the point here? Is the meandering course, is that what gives it its beauty? Just like this meandering intro. Well, to answer these questions, we have Dr. Alexandre Boutet. Now, Alex here is one of our newest radiologists in University Medical Imaging Toronto. He's a neuroradiologist who just started last month. And as far as meandering courses are concerned, he started his medicine and then went on to a residency in neurosurgery and then decided to switch to radiology. And in radiology residency, then decided to do a PhD, which he completed for 4 years, came back, completed his radiology, and he's now one of the youngest neuroradiologists of our group. Alex, it's great to have you here. All right, Alex, much like the reverse course, let's start from the beginning. What excited you to get into medicine in the first place?
So initially, I grew up in Quebec City. And in Quebec, we have this path where we kind of skip the undergrad. We have this intermediate schooling called Cégep. So you're pretty young when you have to decide what university degree you would do. I would think I was about 17 or 16. And at the time, I remember discussing with my parents, because at 16, 17, you don't know much. But I think in the end, what attracted me was the versatility of the medicine profession. And so I think when you're 17, you want sort of a safe bet also. So as medicine, you can be very scientific, very science-oriented, but you can also be very administratively oriented. You could do, for example, an MBA, other careers. You could be a journalist if you really didn't like it. So I think in terms of the options that were left open with medicine, I think that's what really attracted me, because, when you're so young, I think it's really hard to know what you actually like without trying it. And so, then I applied to medicine, and that's how I ended up at McGill University.
Okay, that's an interesting way to get into medicine, and it was decided for you when you were very young. It's just interesting you say that at 16 and 17, you don't know much, but even at that time, you were thinking that, if medicine doesn't work out, I'll become a journalist. It kind of shows that you did have this almost entrepreneurial spirit even right from the beginning, because you kind of kept all your options open. You knew that it was never a straight line, and there were many roads leading from a center point. And so how did your med school in McGill go? And then how was your love for neurology, neurosurgery, and neuroimaging in general? Where was that born?
I think what attracted me first is during high school, I used to volunteer with one of my aunt, which had this house, hosting autistic children. So I used to go there to help her a few times, during the year. So I guess that was brain related. That's how I became interested. And then when I arrived at McGill, I'm usually pretty interested into the history of successful people. And at McGill, there's used to be Wilder Penfield, which is probably the father of neuroscience and brain surgery. And he was the one who's founded the Montreal Neurological Institute. So I started reading about this and all the history. And then because it was the brain was also double interesting. And so I emailed a neurosurgeon there who was a functional neurosurgeon doing deep brain stimulation for a summer. And I started research with him. And I really liked, I guess the mystery of the brain and understanding the circuits and how when those circuits become dysregulated, then it leads to disease that we don't fully understand yet. And and so every summer I went back and then I never left. And then at the time, I think it was very inspiring because there were two very elderly scientists at the time. They were about 95 years old, working in the same lab. One of them was Brenda Milner. I think she's probably 102 or 103 at this point. And she was one of the father of cognitive neuroscience. So I think when you see these people, for me, that have a truly inspiring path and they really like what they did and they made a significant contribution. And then the brain itself, then to me, that was enough to really develop a passion and, continue along the brain and the neuroscience path.
Wow, what a story. I still remember, I think when I was in 8th grade, I walked up to my history teacher and I asked her point blank, well, what's the point of history? All this has already happened. Like, why do I not spend more time, reading about sciences or math or physics or anything which actually might make a change in the future? And to which she answered very coolly, the point of reading history is so that you don't repeat the mistakes of the past. But I think what she might have missed out is your story here, in which history is what inspired you and it motivated you and sparked in you to now become a neuroradiologist. So history doesn't just, it's not just the chronicling of past events, but it has a significant potential, as we see now, to change future events as well. So that's great that now you really knew what you wanted and the mystery of the brain was what attracted you. And is that why you decided to jump into neurosurgery from then on?
Yeah, so specifically, I was working a lot with the neurosurgeon there, putting electrodes in the brain, which delivers electricity and tries to modulate the brain to fix disorder like Parkinson's disease or psychiatric disorders. And so then I went on and had more experience in the United States at Mayo Clinic with one of his colleagues. And then I came as a medical student at University of Toronto, always within the same field of neurosurgery, which is called functional neurosurgery. And then I thought, to me, that was a very nice way of making a huge difference in patients' life, because when for example, Parkinson's patients have this treatment, their life is totally changed. Like, the tremor stops, they can walk right away. And so from a clinical standpoint, that was a very striking difference. And also in a way, from a research standpoint, it's a very attractive opportunity because it's sort of an in vivo experience of probing the brain, probing the function, and see what happens. And, so the treatment enables you to better understand the brain and then obviously make new treatment and, make, for example, what Elon Musk is doing right now with, probing the brain the neurosurgeons have been doing it for 30 years now. So I think it's a very nice academic opportunity while also helping patients.
Oh, Elon Musk and the Neuralink. So you guys are pioneers or like forerunners of the same thing. That's great. And who are your mentors here in Toronto? And how did they set you up on the path to success?
Yeah, so specifically when I came to Toronto as a med student, I came to work with Dr. Andres Lozano. And really because so deep brain stimulation probably started in France in the 90s. But then, as of the early 2000s, I think the pioneering center for the brain modulation was Toronto because of Dr. Lozano. He perfected the treatment for Parkinson's disease. And then, when you're a student and you read about his further advancement for psychiatric disorders, so they were the first one here to implant the electrodes for depression and then for anorexia. And then you can read how, for example, a patient that was on the verge of, morbid weight when anorexia, very low weight, then, you do electrodes and then they can now have somewhat of a normal life. So obviously when you're training, these are very powerful stories. And then you read how Dr. Lozano, took his research side to keep improving the treatments and finding new indications and new place to put the electrodes in the brain, I think is really what inspired me to eventually come at the University of Toronto as a neurosurgery resident to work with him and learn from him. Because again, I think, for me, history is very important. To learn from someone that is successful is a key to being successful yourself.
So it's fascinating that even before med school, you were interested in the brain. All during med school, you were interested in the brain. And then you reached where you had to, under an amazing mentor, under neurosurgery, which is what you wanted to do all along. And this is where we're very interested to know what happened next, or what changed, and how did you make the change from neurosurgery to radiology? Because I'm assuming there's quite a difference, and so how did you decide to make this change in this part of your career, having been fascinated with what you've been doing all along?
Yeah, so I guess the first thing to sort of acknowledge is at the time, because of all this path that was already that I'd engaged for so long. So when I realized this was not maybe meant for me, obviously it was a slightly stressful and anxiety provoking experience, because first you have to understand what you're feeling and you have to acknowledge your feelings, because the career you're going to pick is not for, 2-3 years. It's, literally for decades. So once I acknowledged this, that I would not be able to do this for decades, then I had to think, okay, so what are my options now? And as I was mentioning earlier, I think one of the good things about medicine is there are other options. So you're not really stuck into this single option. And so there's actually an official process at most university. I know at UFT, there's an official process where you can request for a transfer of specialty. Now there's some caveat to this. So obviously it's not easy as a first year resident to go see your program director and say, I am unhappy, I would like to switch. Practically speaking, it's not really how it works. So it's a very sort of stressful experience where you have to approach the other program and try to understand what they would need, if they would be interested to have you, and so it's a very stressful experience. And then maybe the reasons why I switched, I mean, it's still a bit obscure in my head why I did not like it. But if I try to rationalize it, I think in the end, I did not need to perform the surgical part to be happy. I think that's the bottom line. Like if I don't go to the operating room, I'm still happy. Now, I wouldn't mind going a few times, but as a neurosurgeon, you need to like it all the time. And I think the other issue with me was I knew I wanted to have a big research component. I think I like being entrepreneur. And so I thought that even as a staff neurosurgeon, the lack of flexibility in the schedule would not allow me maybe to achieve my goal as easily later on. And also, I mean, for me, that wasn't the most important reasons, but getting a position in neurosurgery in Canada right now is not easy, especially as a functional neurosurgeon. It's, a very difficult task. And I didn't think I was ready to move to another country, to work over there, because my family's from Quebec City and I want to be closer to my family. So these were probably the main reasons why, I ended up thinking that I had to switch out of neurosurgery. And then when I was considering other specialty, obviously I wanted a brain-centered specialty. So radiology was an option to be a neuroradiologist. I also like sort of a fast-paced specialty. So, in radiology, we do a lot of cases. We have to kind of think fast because there's a lot of things we have to do during the day. And also I wanted to be part of a team. And I know this sounds a bit counterintuitive for most people, but I think as a radiologist, we're part of a big team. We interact a lot if we want to with the other specialties. So in the end, I thought that would be a good choice for me.
That's amazing. You evaluated what you felt, what you needed, and you looked forward and saw where you would like to be. And then you made the decision to kind of make this change. And I guess in the end, it all came down to not wanting to have your pillow and blankets in the OR. You kind of wanted to sleep in the comfort of your own bed. But it's a great decision. But how did you feel maybe in the first year after you made the switch? Because you've done residency in neurosurgery for a year or so, and then now you've switched to radiology. And at that point, what differences did you see among the two specialties? And do you really think that one specialty is better suited than the other? Not just in terms of like career, because you're just starting out, but just in terms of residency and surviving residency, so as to speak.
So the transition was obviously not easy, especially so when I thought as radiology, I only thought about brain imaging. But obviously, when you do radiology, there's a lot of other things to learn, which I did not think about thoroughly when I did the switch. So the first 6 months were difficult because I had to learn, the chest, the abdomen, the bones, the muscles, which I did not know a lot about. So yes, the first 6 months in a new program with a lot of foreign knowledge and starting the call with very unfamiliar topic was not an easy experience. Also, in surgery, you spend a lot of times with your colleague, especially as first year, and so I had to be accustomed to new resident friends, new social circles. So all these factors combined made the second year quite difficult. But the good thing is at the time I was at St. Michael's, which is a smaller hospital where we hang out a lot as radiology residents. So that facilitated the transition. And then I guess to answer your second question, I think in the end, for me, what is really important is to make a difference, for the patient. And I think as radiologists, a neurosurgeon, or any specialty would do that. So as long as that's the ultimate goal, I think you can be happy in any specialty. And then, as I say, I knew that at the end of the road, if I really still only liked the brain, that would be possible. So as radiology resident, you have to learn the whole body, which was probably not the best fit for me. But, I don't think there's a perfect, position or career for anybody, right? There's always pros and cons. And for me, the cons of learning the rest of the body were still better than me, being in the OR all the time for the bread and butter of neurosurgery, which would be spine and, removing discs and traumas. So in the end, I was still happy with my choice. Yeah.
That's great. So you said that you had some difficulty because you had to learn other things, as well as that you had to create your own friend circle among the residents. But then, once again, you made a switch, or you meandered a bit, because if I understand correctly, you were in the clinician investigator pathway during your radiology residency, and you did PhD, which again is not a common choice or common road people travel on. So what led to that, or how did you end up on that path?
So I guess after the switch, there was a year where, I was a bit turned off from neurosurgery and the brain itself. I was just happy I switched, and that was a stressful process behind me. And then at some point I was at St. Michael's, and one of Dr. Lozano's prior PhD students, which now works at Sunnybrook as a staff, Neil Lipsman, which is a great person and was actually my mentor when I was a medical student and he was a resident. And he told me, if you really like this research and you like the brain and the brain circuitry, Dr. Lozano will not have any hard feelings. Just ask him and, contact him. So that's what I did. And that was right. Like, he did not have hard feelings. Then he take me on, as a PhD student. For me, in a way, in retrospect, now it was almost a good thing, because even if my radiology training was short by then, I still brought something different than if I was a neurosurgery resident. But I brought imaging knowledge that in neurosurgery they usually don't necessarily have. I brought a different interest, a different point of view on the neurosurgery projects. So obviously they were more neuroimaging centered rather than mainly clinical trial centered. So yes, I think I just went with my heart, what I really liked, and we put the hard feelings beside, and then that's what happened. And also in med school, I done a similar thing. I took a year off to do my master between second and third year. And at the time, this is when I really decided I really like research. I really like to know more about the brain. So I think taking this time for yourself, which is outside of the regular path, is important to understand yourself and know about yourself and make better decisions. And I don't know if that's related, but I think starting so young in med school was probably, in a way, the drawback of doing this, because you don't really have time to know yourself better. So in the end, those years that I didn't do as an undergrad, maybe to mature more, than I just did them, later throughout med school. So maybe that's probably one of the problem of starting so young, is you don't have time to think and learn about what you really want, what you really like to do.
That's interesting that you bring up the point that, you had to make the switch later in your career because you threw yourself headfirst into medicine when you were younger. But now that you've gone through this route, what is your opinion on this? Do you think that it's ever too late to change paths? It's ever too late to go on a different road? Ever too late on, give up whatever you're doing and just go on a completely different course? Or do you think that it's wiser to have all details up front and make decisions up front? Because it potentially could be argued both ways. As things change with time, so does your perception on things, so does your idea of certain stuff, so does your passions. So what are your thoughts on what's the right time to make a switch, if at all?
So there's probably exceptions to every rule, but my answer would be, it's never too late. I think, for me, I always try to think, 10 to 15 years down the line. So for me, if I'm, going to delay my path for 1 or 2 years to then be happier for the next 10 to 15 years is an entirely worth it scenario for me. And then, I guess around me when I was growing up, there were a lot of unhappy people on Sunday night that did not like what they were doing on the Monday morning. And I remember this, and, I told myself, I don't want to, I want to be sad that the weekend is over, but I also want to look forward for the coming week. So that's sort of the just balance I want to be in. And I think if you think like this, then if, you keep not liking what you do, it's never too late to switch. Now, it might not be the easiest option, but, the easy options, don't pay off as much. So yes, the hard options will have difficulty, but there are mechanism in place to help you and to change, and then you can explore options. And to be honest, I think if you sit down and try to think about all the pros and cons about every scenario you're going to pick, I think it's very difficult without actually living it. And I think that's actually one of the problems with the current medical path, is we kind of have to pick without actually living the experience. Yes, as a medical student, you can shadow a resident. Yes, as a resident, you can shadow a staff, but in the end, until you sit in the chair and do the work, I think it's always a bit of a shot in the dark to see if you're going to like it or not. So to me, I think you just have to go for it, and you just have to be cognizant that it might not be the best choice, and you might have to just reorient yourself slightly after to have a better fit.
That's a perfect response. I think you summed it up very well when you said that on a Sunday night, if you're regretting waking up on a Monday morning, then it's time to maybe reconsider your choices. And sometimes it is worthwhile making those hard decisions in life, because that, as you rightly put, would set you up better to be happier for the next 15 years. And you had a hard decision I mean, it was almost like you were breaking up with your childhood sweetheart, your long-term girlfriend, when you decided to switch from neuroradiology. But it's amazing that you decided that, hey, I'll just reach out, I'll just stay good friends, and that set you up for the future. So how do you think that all this meandering course of you getting into med school, doing neurosurgery, then jumping into radiology, then doing the PhD pathway, how has that set you up for the future? And also, how did that end with you joining here? And what were your decisions when you decided to stay back in Toronto, stay back with UMIT, with University of Medical Imaging Toronto?
Yeah, so I think the advantage of the meandering is, the more turns you take, the more unique it makes yourself as a person applying for a position. So obviously, if you have a different path, then you're going to offer different skills to a position. And I think, this is why I don't think there's many other radiologists, probably even worldwide, that do what I do, because most radiologists will not take this path. So, for example, most of the neuroimaging projects I do are very centered on neurosurgery, neurosurgical outcome, as opposed to being more centered on radiological outcome. Also, my interests are, they're more aligned with, neurosurgery when I design projects. And so for the neurosurgical team and even the neurology team, it's a very different, I guess, collaborator than they're usually used to, because I guess I think in a similar way to them than other radiologists, just because of the path, because of all my time I've been collaborating with them. And so in the end, because I really want to be focused on neuroscience, the brain circuitry, for me, staying in Toronto was a logical option, because building this network of collaboration takes years. And if I were to move somewhere else, I think, the task of redoing this was huge. So staying in Toronto, staying with Dr. Lozano, staying with the neurology team that I've been working with was just the logical option for me. And then we had so many projects that were ongoing. They're exciting. And I wanted to continue them and further them. And also at UHN, the radiologists, the academic activities are encouraged, more than average compared to other places. And so for all these reasons, I think this was the perfect fit for me to continue doing what I've been doing.
That's perfect. And as you rightly pointed out, and we have had previous discussions with other radiologists as well, this is the largest academic medical imaging group in Toronto, and there's dedicated, protected time for research, and we probably offer the highest amount of research time for all radiologists. So yeah, you're right where you're supposed to be, in a group which encourages such academic curiosity and academic innovation. So tell us a little bit more about what you're working on. And I also hear that you have a few fellowships coming up as well. And you're going, like you already said, that you were at Mayo Clinic, but you're going to more centers in the US. And also, we were speaking about electrodes and deep brain stimulation. Could you tell more about your work in those areas?
Yes. So specifically, what we try to do is, when the electrodes are implanted, historically speaking, they were always implanted in a similar way for every patient. So you use anatomical landmarks, you find your target, and you put it in the relevant circuit. So in Parkinson's disease, you would implant them in the motor circuit, and in depression, you would implant it in the mood circuit. But then with imaging nowadays, because the techniques are becoming so good that we're looking at whether, for example, in a Parkinson's disease patient has more tremor versus a Parkinson's disease, which has more difficulty with gait, whether we could do the surgery slightly differently to target the gait network preferentially over the tremor network. So the first step was, can we individualize the targeting of those surgeries? And that would be based on the networks in their brain prior to surgery, their specific anatomy of the brain. And once the electrode is in, then there's an important step which the neurologists do in Toronto, is to adjust the electricity for every patient. So this usually takes months to years to adjust and get the optimal balance between the best efficacy, but also not too much side effects. And so rather than doing this with Dr. Lozano and Dr. Fasano, which is a neurologist, we place the patient in the MRI and we do a special pictures which we look at the function of the brain called fMRI. And then we turn on the electricity and then we see the brain lighting up. And then when the lighting up pattern is what we call the best pattern, then we know the electricity is good. So what we do now is we think we can take this 1 year programming process into 1 to 2 MRI session where we acquire an fMRI, we look at the colors, then the machine will change the electricity to then adjust the pattern to match what we know is the best pattern to get. So eventually we're hoping to have this sort of feedback loop in the fMRI, which will then adjust the electricity by itself until the right colors are popping up on the brain when we look at the images. So that's the ultimate goal. And then in terms of a fellowship, I always personally believe that, where you're going to work, you should probably train a little bit somewhere else to bring something new. And because I've been in Toronto for so long, for me, it was important to get outside of Toronto training. And one treatment that we do in Toronto was actually pioneered at Sunnybrook is called the intracranial focused ultrasound. And through my experience with the neurosurgeon and radiologist, I learned that there's a radiologist in Dallas, Texas, that does the whole treatment by himself. So he sees the patient in clinic before, he does the treatment, and then he follows them in clinic after, sort of like the traditional interventional radiology practice. And so for me, that was really appealing because most places are usually neurosurgeons doing it. And so I contacted him that, in the future, possibly I would like to have a similar practice at UHN. And so I will be going with him for 3 months this fall for further training. And then afterwards, I would be going 3 months to University of San Francisco to learn more about advanced brain technique images that they do over there, but we don't do here. And so hopefully I can bring back new knowledge to improve our practice here.
So that's perfect that you had 2 skill sets now, your love for neurosurgery and your love for imaging, neuroimaging. And now you're working on the border between the two, in which you can incorporate the best elements of imaging and the best elements of surgery to provide cure or to provide help to people with those diseases which were traditionally considered very difficult to treat, like Parkinson's and other diseases which weren't considered organic, which were more functional diseases, and you're managing to try and get an answer for that. And that's absolutely amazing, and we look forward to all the great work you're going to do. And in terms of the upcoming fellowship, so what you're saying is that although you did take a lot of change of course, a lot of twists and turns, you're still not done. You still want to take more twists and turns. You still want to go to Dallas. You still want to go to UCSF. And that's just the beginning. I think that you're going to seek adventure wherever it lies, and you're going to forge your own path, just like the Colorado River did with the Grand Canyon. You're going to leave an impact which is going to be looked at by people in the future, and you will be serving as an inspiration like your mentors did in the past. Looking back at your life now, is there anything you would have changed or anything you would have done differently?
That's a difficult question because although from an outside point of view, my path being convoluted and not the most straightforward path might seem a not ideal path, I think for me, in retrospect, I'm quite happy with what I did. And I think those detours were important into, what I am today, which is a neuroradiologist at UHN. And again, I think those detours are important, and I would not change them. I think me going into neurosurgery and then switching was important into the individual I am today.
So we just listened to Dr. Boutet talk about his unusual course which he took in his budding career. And that reminds me of a poem which I was taught when I was very young by Robert Frost, The Road Not Taken. As the poem goes, two roads diverged in a yellow wood, and there was one traveler looking at both. And the poem ends saying that I took the road less traveled, and that has made all the difference. However, analysis of the poem says that this is one of the most misunderstood poems of all time, because most people think that this poem champions the idea that you need to take the road less traveled. Actually, this poem was written in irony. Frost wrote the poem as a joke for his friend Edward Thomas, who was often indecisive about which route to take when the two went walking. So, his point was that whichever route you go, they're sure to miss something on the other path, but then they're sure to have an amazing adventure on this path. So, I can just leave you with this. No matter which road you take, it's not the road which matters, it's not the destination which matters, it is the journey. And if you feel that the road you're taking is not that great, take the next exit, loop back to the other road, and you can just continue your amazing journey. And with that, ladies and gentlemen, that was Dr. Alexandre Boutet, neuroradiologist, University Medical Imaging Toronto, the largest academic medical imaging department in Canada. And me, your host, Satish Krishna. You were listening to Radiologists, a podcast by University Medical Imaging Toronto, the largest medical imaging group in Canada. Produced by Ina Levchuk. Learn more about us at universitymedicalimagingtoronto.ca and follow us on social media at Imaging Toronto. Thank you, everybody. See you on the next one.